Okay, let's begin the recording. Lovely, thank you, Nathan. Matanva agus Falcha, good morning and welcome everybody. Welcome to board members and members of the public and press who are accessing our meeting today. And this is our board meeting for November for NHS Highland. It's lovely to see you all. So just a bit of housekeeping before we begin. You'll have noticed that we are recording the meeting so that we can upload that to the web in the future. And just to remind people, a bit of online meeting etiquette. We don't use the chat function in this meeting. So if you want to ask a question or make a contribution, if you could use the hands up function. It's lovely to see people's faces. So if you are able to keep your camera on, that's lovely. Obviously, if you're having issues with your connectivity, you can switch your camera off. That usually helps. And if I could just ask everybody to remember to keep on mute unless you are asking a question or making a contribution, just to reduce the background noise. So before we get into the substantive parts of our meeting, I just want to say a few words about a few people. We've got some comings and goings. So I'd like to first of all say a few words of thanks to Susan Ringwood. Today is Susan's last board meeting. So Susan's been a non-executive with us since the 1st of January 2021, and her term is coming to an end at the end of this year. So we have got Susan for a little bit longer, but this is Susan's last board meeting. So it just felt like a good opportunity to say thank you. And to pay tribute. So Susan's made a massive contribution to the board. Susan's been on the audit committee throughout the whole term and then took on the vice chair of that committee in 2022. And has recently moved in to support the committee by chairing it while we go through some other transitions. And that's been a real help. Susan's also been a member of our Pharmacy Practices Committee since 2022 as well, and played a really key role within our Argyll and Bute IJB, our integration joint board that oversees the health and social care partnership in Argyll, where Susan stays. And she's been the vice chair of their audit committee for several years. So a massive thank you, Susan. You've given so much to the board. You've been so dedicated and diligent, and a huge thank you from me and from all the team as well. And we, of course, wish you all the best for your adventures in the future.
Thank you very much for those kind words, Sarah. And it's been a real pleasure and a privilege to be able to contribute to this board. And I'm so grateful I had that opportunity. I wish everybody really well for the challenging times that are coming ahead, but I've got full confidence in your abilities to do what needs to be done, all of you, the way you work together and the way you face the difficult things that need to be faced. Great admiration for that. And thank you also for my kind gift, which you surprised me by giving me when we met last week. That really caught me out. But I've already bought myself a new pair of walking boots, so they're lovely. Thank you.
Excellent. Oh, good. Oh, I'm very pleased. Yeah, and you'll be sitting on my shoulder every time I look at some data, Susan. I'll hear your voice just in my shoulder, reminding me to look at trend lines and forecasting, and yeah, you'll be there. Also, a really some lovely news as well. I'd like to extend congratulations to somebody joining our team. So Kristen Gillis has been appointed to the interim head of strategy and transformation. Some of us know Kristen. She brings a wealth of experience to NHS Highland, and she previously held the role of head of strategic planning, performance and technology in our Argyll and Bute partnership. So Kristen is known to some of us, and the rest of you will get to know her over time, and we'll see her at future board and committee meetings, and we're really looking forward to working with Kristen in her new role. And also, just to update people, I did a recruitment exercise and completed interviews, and I have now filled some vacancies that we had for non-executive directors. So that's to replace Susan and other vacancies that we have coming up in the future. We got lots of really high quality applications, actually, and it wasn't an easy process. We spent a lot of time working through that, and once we've had all the official paperwork through, I will be able to announce the names of the successful candidates who will be joining our board in the future. So that's really good news. And just one last thing, I wanted to say a really big thank you to our communities, board members, staff, partners and stakeholders who all took part in our annual review, which took place recently in Argyll and Bute. I won't steal the thunder. I think Fiona's going to touch on it in her report as well. But it was great to see so much engagement, both during the event but also beforehand. So that was fantastic, and all the staff behind the scenes that pulled that together to make it a slick operation. That was much appreciated. Okay, I'm going to move on to the business in the agenda now. So first of all, Ruth, do we have any apologies?
Thank you, Sarah. Yes, we do have one apology for today, and that's from Philip McRae. I'm also conscious as well that Jerry O'Brien will be a little bit late in arriving. But Jerry will be here soon. Thank you.
Okay, great. That's fine. We'll keep an eye on that. Let's see when he arrives. That's good. Thank you. Next, do any board members wish to make a declaration of interest? Alistair.
Yes, good morning, everyone. I had considered making a declaration of interest in my capacity as a Highland councillor, but having looked at the agenda and my personal connection to the items on the agenda and having applied the objective test, I feel I don't need to do so. Thank you.
That's great. Thank you, Alistair. And Steve.
Morning, Sarah. Morning, everyone. Similar to Alistair, I considered making a declaration as an employee of High Life Highland, but having applied the objective test, I don't feel it's required. Thank you.
Okay, that's great. Thank you, Steve. Okay, so that takes us on to the minute of our previous meeting. So seems not that long ago, the 24th of September. So that minute is in front of us today for approval. So I'll just pause if anybody's got any matters of accuracy they need to raise. No, I'm not seeing any hands up. So are members happy to approve that as an accurate record of our meeting? Yep, thumbs up. Great. Okay, and we have the action plan as well. We've got two open actions. I'll take those as read unless anybody, I don't know, Ruth, if there's anything we need to be aware of, if anybody's got any questions. They're both in progress. Emily.
Thanks, Sarah. I guess just on action 26, having a due date in the past and kind of in due course in the notes is not the best situation. So if it is ongoing, I wonder if we might take it off. But otherwise, is there a future due date that we could look at, or maybe just a bit more specifics on when it's due? Thank you.
Thanks, Emily. Yeah, we'll take that offline and we'll discuss what a more appropriate date would be. So we did talk about the IPQR, as board members will remember, at our board development session that we had in person. And I think there were some really good ideas came out of that. I think we haven't quite finished that piece of work yet, but we can take that offline, Emily, and I think about what a more appropriate date would be, and we can bring that back to the next meeting if that's okay. Yep. Okay. Other than that, so we can take that away and update it. Is everybody happy with the two actions that we've got on there at the moment? Yeah, okay, super. So that takes us on then to matters arising. And Ruth, I think we've just got one item here.
Thank you, Sarah. At the last board meeting, we agreed the dates for your meetings, for your committees and your board meeting for the next 2 years. And that was subject to confirmation that there was no clash with the IJB meetings. And I can let you know now that there is no clash, certainly for the next year ahead of us, there is no clash with the IJB meetings. And I'm conscious that some of the calendar invites have already started to be issued to you. Thank you.
Okay, that's great. Thanks, Ruth. I'm not seeing any other hands up, so I think that we're fine for that. No other matters arising. No. Great. Okay, I shall move us along. So I'm going to invite Fiona. We've got item number 2, which is our Chief Executive's report. So Fiona, I'll invite you in, please.
Thank you, Chair, and a warm welcome to everybody joining our public board meeting today. Chair, you're quite right. I am going to reference the annual review that was held last week in Lochgilphead, this year without a minister from Scottish Government, but following the same structure that we've done in previous years. I suppose I wanted to offer a word of my own thanks to all the staff and public who took the time to submit questions, attend sessions in person or online throughout the day. I found that the feedback that's received throughout the event is particularly useful for me in my first year in this role to get a sense check of the various perspectives on the strength and areas of development across NHS Highland. I'd also like to extend a note of thanks to Argyll and Bute Council for hosting the event, and to all the services in Mid Argyll who offered our executive and non-executive colleagues a chance to see elements of our service delivery in that area. Right, turning to the details of my report, I'd say the central theme for this board meeting is sustainability. I'm sure that you'll recall that in my verbal comments supporting my last board report, I highlighted that one of our nursing homes in the Highland area, Moss Park in Fort William, had been identified for closure by its owners. Since that time, the senior teams in both NHS Highland and Highland Council have been working very closely together to work through the options. And as a result, we've come to a decision in principle that the home will be purchased by Highland Council and operated by NHS Highland. I'd like to commend all the staff involved in making that possible, but also to the community activists who represented the views of local people and the strength of feeling in regard of this matter. Whilst on this occasion a good outcome has been achieved, we must be vigilant that the factors that lead to the closure of homes across Highland remain at play in our social care system. We hope that Loch Arbour will now lead the way in innovating home-based care models, and that within 2 to 3 years we will see a greater proportion of the population being cared for at home, which we know is the wish of most people in receipt of care services. But sustainability is also something that's on our mind in regard of our acute health system, where we know that some of our services are no longer sustainable. And planning is underway to change models of service delivery to ensure that safety and quality remain the core tenets of our planning. As part of the reform programme launched into the Scottish Parliament earlier in 2024, it's been recognised that collaborative planning across boards will be needed, and we anticipate that vascular services will be the first service to be redesigned through this new approach to national planning. In the meanwhile, NHS Highland is grateful for the support of other boards across Scotland who are already meeting the needs of some of our vascular patients through arrangements closely monitored in our clinical governance and clinical quality systems. Oncology redesign is also underway, and further updates on the national planning will be routed through the same committees. I would also draw the board's attention to the submission to Scottish Government of the Highland Area Options Appraisal in relation to the vaccine delivery model. I remain keen that Highland need to maximise the availability of workforce to deliver vaccines across our area, and I look forward to engaging with the Scottish Government to conclude decisions about the model. Wide engagement has been undertaken in developing our submission, and I thank all of our staff and partners who have been actively involved and sharing their expertise in this improvement work. In other good news, we've recently been awarded the JAG accreditation for our endoscopy team, a first for any board in Scotland. Not only does this confirm the quality of the clinical standards and patient experience, but it means that Highland can now contribute to the teaching of endoscopy skills, increasing the available workforce across Scotland. Congratulations to all of the endoscopy team. You're a credit to our organisation. Finally, I would like to pay tribute to 2 people who've provided invaluable support to NHS Highland through their contribution to our key engagement groups, and who both have sadly passed away recently. Both Betty Roddick in Mid Argyll and Ross Cowie in Skye made huge contributions in their local communities in many ways, and both will be sadly missed. I'll pause my comments there, Chair, and I'm happy to take any questions or comments in regard of my report. Thank you.
Thanks, Fiona. That was a really helpful report. I think you've done a good job of giving us glimpses into various parts of the organisations, both the challenges and the areas where we're doing well. Also, just to pick up with regards to the JAG accreditation, I was lucky enough to visit the endoscopy unit. It was a bit before they'd actually had it, but they were working towards it. And yeah, a huge amount of work goes into achieving that accreditation. And it's not a quick thing to do. They've been working at it for a really long time. And the fact that they've achieved that accreditation, really testament to their persistence and dedication and the quality that they've had to demonstrate and evidence in order to achieve that. So that's really great to see all their hard work coming to fruition. Okay, I'm happy. There was a lot in Fiona's report, but I'm happy to take any questions or comments that board members might have. Graham, I'll take you, please.
Yeah, and apologies, for some reason I don't have a working camera today, so I'll just need to be on audio. Fiona, just to maybe echo the point about the review being held last week in Argyll, and speaking on behalf of the IGB, it was an excellent day. We certainly appreciated your presence, and I think it reminded us all of the huge distances that we have in the to cover across the organisation, and we appreciate the time that all the execs took to come down and speak. The visits were certainly very worthwhile too, and I think it helps and address a kind of recurring issue that we have in Argyll about just being in part of NHS Highland. I was speaking to a local person where I live on the Rosneath Peninsula in Argyll at the weekend, who couldn't believe that they were actually part of NHS Highland, because their comment was, yeah, but it's called NHS Highland and we're in Argyll. So it's I think having these events, having the things as integrated as possible is really important. I know there are huge challenges with that, but certainly we look forward to working closely with you over the coming months. So thanks for that, Fiona.
Sarah, can I just come and respond to that? Is that okay? So Graham, thank you very much for your comment. Both myself and Sarah felt it was fitting that, given that the review was done last year in Inverness, that it would be sensible to do that in another location across the board area. And as I've said, the council are fortunate to have excellent hybrid facilities which facilitated participation. We had stakeholders and staff from Caithness through to Campbelltown who were able to participate. So that really did maximise the inclusivity of the event. But as I was referencing in my report, the way that we're thinking about planning in the NHS as part of reform is changing. And one of the areas that we'll need to strengthen is how NHS Highland connect to planning in the west of the region as well as that in the north region, to ensure that the pathways of care in Argyll and Bute remain steadfast and strong, utilising acute services in Glasgow, as well as the arrangements we have with those sustainable services, or the issues we have with sustainable services that I referenced in the north. So, I mean, it is a good reminder to us that we're a board that, if you like, faces in two directions, and that has to be essential in the way that we're structured in our delivery, but also in our governance. Thanks.
Thanks, Fiona. And I wonder if I might bring something in just on that point before I bring Alex in as well. I think it can be easy for an organisation, headquarters are in Inverness, and we can feel a bit Inverness centric, but I suppose I would reflect on work that myself and others have done over the years to try and strengthen that Argyll and Bute representation. I think we're very lucky. We've got some really strong Argyll and Bute representatives around the table at the moment, and that kind of visibility is increasing in a really positive way. I suppose I would also reflect that we often talk about the challenge of covering such a huge geographical area. We love that little catchphrase, Campbelltown to Caithness, or the other way around, depending on who you're speaking to. It's a massive area, more islands than any other health board, and biggest geographical area. I also see a huge amount of opportunity there though as well, and certainly I think we're seeing more of that coming through, where we recognize there are learning opportunities from different parts of the organization that we can pull across and share. It isn't always easy to do that when our communities are so far apart from one another, but I think there are huge advantages to having all that wealth of experience and learning at our fingertips, and I think it's really important that going forward we absolutely maximize on that, and see where we're doing well, and see how we can replicate that across all of our communities. Okay, I'm going to bring Alex in next, please.
Yeah, thanks, Chair. Morning, folks. Yeah, Fiona, the vaccination discussions you're having with the government, obviously we had the tragedy in Caithness when we lost a baby because of vaccination issues. Are we moving forward the way we want to go, or is it still being stuck in this we can't use GPs, etc.? Because when we look at Caithness, when we look at Sutherland, most of the time it's actually beneficial for the community to have GPs doing it rather than waiting for NHS vaccinations to get there. They're travelling long distances to get to the vaccination outlets, we'll call them, that we've got. Places like the Royal British Legion in Thurso or whatever in Wick, where they've got to come to all that. Whereas when there was GPs, it was much more local for them. Thanks.
Thanks, Alex. So, as I said in my report, we've worked really hard over the last number of months to develop a submission to government to vary the model, which is the options appraisal process. And we've worked particularly closely with GPs through a short life working group to come up with a proposal to government. We're now at a stage where we need to start that conversation of agreeing with government whether what we've submitted is acceptable to them, and I'm hopeful it will be, because we've had a really broad range of support from our partners as well as from our own staff who are delivering vaccines, who we've taken extensive feedback from in terms of their experience of delivering vaccines, what's going well, and also what they find to be challenging within that. So I wouldn't say we're stuck, but we have to go through the process of working with government to agree what the next step's going to be. That will of course take some time, but we hope to keep things moving as quickly as possible. We've got meetings already scheduled to take that forward. So I would hope as we progress through our board meetings, I'll be able to bring further updates that can give us more certainty in terms of what the model will be. But I feel that the piece of work that's been done to get to this point is thorough. It's engaged well with stakeholders, and it has a huge amount of positivity and unanimity within Highland about what the right way forward is. So now we just need to get these agreements concluded. Thanks.
Thanks, Fiona. Okay, just check to see if anybody else wants to make a comment or ask a question. Okay, not seeing any other hands up. Thank you, Fiona, for that update. That was really helpful. I will move us on now to our governance committee assurance reports and the minutes that we have in our pack. So obviously these minutes are in front of us for us to confirm that we've had adequate assurance from them, and for us to note the minutes and the actions from the area clinical forum and IJB. So I'll go through them and chairs can bring any highlights that they need to. So first up, I've got finance, resource and performance, FRP. We've got two sets of minutes with us. We've got the minute from the 11th of October and also the draft minute from the 1st of November in front of you all. Alex, any particular highlights you want to bring to the board's attention?
Yeah, I've got some notes here, Sarah. I'll just read from them. That'll be the easiest way, and then we can ask to get questions, etc. So, starting the October meeting, financial position at month 5 was discussed. A forecast overspend around about 50 million by March 2025 was reported, and we took limited assurance from the information that we were given. We also had a long discussion on the planned care trajectories. They showed an increase in referrals in certain specialities, and it was stated that the activity plan had been agreed with the Scottish Government and was being delivered to that plan, which was good. Moving on then to the November meeting, the financial position at month 6, there was an increase in the overspend up to some 52 million, This was mainly due to reduced allocations from the Scottish Government, and there was further discussion going on there. And I'm sure Herbert will give us more information on that later on this morning. The Financial Escalation Self-Assessment Report was discussed, and it was agreed that the Scottish Government assessment of Level 3 escalation for finance was appropriate. We had an excellent presentation on the progress of the Meridian support that has been given to the board, and it was agreed that further updates would be provided at further FRP meetings. Similarly with the IPQR, that was discussed, noting that the latest reports included performance against our ADP deliverables. And we also had the annual report for procurement, and it was noted that there was a very good report giving substantial assurance in compliance with legislation, policy and board objectives. Finally, the Director of Estates brought the NTC post-occupancy evaluation report to the committee. This is a very important report, and it was one that we were looking forward to, but we were expecting to see it in December. Unfortunately, what happened was the Scottish Government had brought forward the deadline for submission. So we actually got this paper the day before the FRP was to meet. There was obviously a lot of key messages in the report, and we've done very well, but the committee members agreed that we needed much more time to study and explore the paper in depth. So as such, we could not approve the report on the day. It was, however, acknowledged that the report would go to the Scottish Government without approval, and this would be noted in the submission. Yeah, any questions on any of that? Thanks.
I have a question actually. Are the committee going to take that report again at the next meeting to kind of ratify that? Yeah, okay, that's great. Thank you.
It's still coming in December. I mean, we had a presentation by Richard and the team, and as I say, there's key messages in there that they've done really well.
Yeah.
But we just, it was 120 odd pages. We just didn't have time to give it due justice. That's the reason why we said we couldn't approve it.
Okay, no, that's fine, and that'll come through in December, so that's really helpful. Any questions for Alex on FRP? No, that's great. Thank you, Alex. That's a helpful update. I will move us on next to staff governance. So we have the draft minute of the 5th of November in the pack, and I'll invite Anne to give any highlights to the board.
Thank you, Sarah. Morning, everybody. Well, unusually, I want to start by celebrating some successes. So I just want to draw your attention to the excellent improvement work that has been carried out by our teams to address our time to fill vacancy metric. By drilling down into the data and undertaking a focused piece of work, we've seen this metric improve to within a couple of days of the target, which is great news. We, of course, need to demonstrate that that position can be sustained and also look further at why a small number of vacancies are becoming extreme outliers in the length of time it takes to recruit. But overall, a great effort by our teams, and the committee is hoping that it will be similar good news at our next meeting when we get some further reports on the improvement work to address Statman and PGPs and appraisal. And it was also great to approve the final version of our health and wellbeing strategy. And we're looking forward to the launch of that. And the only other matter that I really want to draw the board's attention to, because we have the whistleblowing Q2 report on our agenda today, is just to highlight that we had a fairly in-depth discussion at committee about how we can improve these reports to give further assurance that learning from the cases is being shared effectively across the organisation, and that the right people are kept sufficiently informed of progress in implementing actions arising from the cases. So you'll see the report has some additional information on that this time round, and we will be monitoring that closely in terms of the effectiveness of these additional measures introduced in this report in the next few months to see whether our colleagues are satisfied that that has given the assurance that we need. So I think that's it, Sarah. You have the draft minute there, and happy to take questions on any of the other items noted.
Thanks, Anne. And it's great to see some of those areas moving forward as you've described. I know that those have been challenges for us, so it's great to see that that intense work has paid off. So thanks to everybody involved in that. Anybody have any questions or comments for Anne on staff governance before I move on? No, okay, that's great. Thank you, Anne. Next, we have our Highland Health and Social Care Committee draft minutes for 6th November. Unfortunately, we don't have Jerry or Philip here, so I'll just ask everybody to note those minutes, and if we have questions we can pick those up with Jerry offline after the meeting. Jerry's always happy to talk about the Highland Health and Social Care Committee, so I'm sure he'll be delighted with that. Next we have clinical governance. This is the draft minute of the meeting on the 7th of November, and I'll invite Alistair for any highlights.
Yeah, thank you, Sarah. Apologies, there's some building works going on round about me. Service suddenly starts banging. It is not me, honest. So we had a very productive meeting going over some areas like the Finance and Performance Committee. We looked at our integrated performance quality reports in some depth, and we also took assurance reports from the Highland Health and Social Care Partnership, Acute Services, and the Infants, Children and Young People's Clinical Governance Groups. We had updates on a 6-monthly update on the health and safety, where we were able to take a moderate assurance on the actions being carried out under that. The key item on the agenda, which I want to draw attention to, is that we added and discussed 2 new items of risk, and this nicely links back to the Chief Executive's report, Fiona's report on access to services and the challenges that we're facing with recruitment of staff, like many other public sector bodies in Highland and Argyll. And sustainability of services. So I'm not going to dwell on that and repeat what's already been said this morning. The other thing I was going to mention, again, the Chief Executive has taken that ahead of me, which was the situation with the public health vaccination update. So again, Sarah, I won't go over that. We finished by reviewing our progress, which was very good, on the blueprint for good governance and the self-assessment that we did on that. And that really was the main items that were discussed at the meeting, and I'm happy to answer any questions that people might have.
Thanks, Alistair. That's really helpful. And as you said, Fiona kind of picked up a lot of those key items in her report, but it's helpful to understand how the committee have scrutinised those areas as well. So thank you for bringing that to our attention. Any questions or comments for Alistair around clinical governance? Nope. Okay, thank you, Alistair, for the update. That's helpful. And what do I have next? Lost my place. Aha, we have the Area Clinical Forum, and we have the draft minute of the 31st of October. And I'd like to invite Katrina for any highlights for the board, please.
Thanks, Sarah. We sadly weren't co-rate for that meeting, but also thankfully we didn't have any great decisions to make, so we were okay and we carried on. But I suppose for 6 meetings within a year, I think it's only the 2nd time we've not been co-rate, which is actually quite something when you're looking at the group of people we're trying to pull together for these meetings. So we had plenty of guests with us, which was really good. I think really well anticipated was the completed weights dashboard, which is the new name for the GP weight data. And there was lots of feedback into that, and I think there will continue to be feedback into that to try and make it bigger, more comprehensive, including data from out with necessarily just NHS Highland to see how that impacts. And also, you know, it was highlighted that there's lots of AHP data out there that's not included, but due to the technology involved, there's so many different systems, so with data on it, and it's difficult to collate. So I think it highlighted a lot of the technical challenges, but we do have to remember this is iteration 1 of this, so it's got a long way to go, but it was a really good talking point as a starter, which was really useful. And then we had a really interesting presentation about long COVID study that's been going on in NHS Highland, and it's a real multidisciplinary team bit of work that's been happening. So there's going to be sort of more a bigger presentation going forward, I think, with regards to what needs to happen, because there's a general feeling that if it doesn't go into the integrate into the specialities that exist already, then it'll disappear, because it's people from across. It's not just a group on its own. These people have other things happening in life as well. But also was really interesting was that the evidence they had that vaccination gave protection against long COVID as well. And it was really interesting to hear that information. So hopefully that information will go through other routes as well. And then we had an update on the quality framework, which we did as a joint event earlier in the year, which was really good. And how that's going to be taken forward, lots of questions about how we manage it well for people, for staff, and how to make it business as usual as well. So very constructive feedback with regards to that. And I would just like to say the feedback that with regards to the annual review as well afterwards was also, which was a separate event, but the ACF members at the annual review were very positive with regards to that as well. So thank you for having us to that as well. Thank you.
Thanks, Katrina. And if you hadn't mentioned it, I was going to mention that that very thing. I found that meeting with members from the ACF in the morning of our annual review day really, really helpful. I thought there was some really good conversation and ideas came out of that. Obviously, Fiona and I and yourself can have a look about how we take that forward. But I thought that was an incredibly constructive conversation. And yeah, picking up on the joint development session we did around the quality framework, it's great to see that kind of moving along. And as again, something we were talking about at that meeting was thinking about how would we kind of do that again? What would be a good use of joint time with members of the ACF and the board on further development work? So that's kind of ticking away in the back of our brains, and we'll bring that forward again in the future. Thanks for that, Katrina. Any questions or comments for Katrina for ACF? I know that lots of members go to ACF on a kind of rotational basis, so some of you will have been privy to some of those conversations. Great, no questions. And last but definitely not least, our Argyll and Bute IJB. Now, this is always out of sync, isn't it, Graham? The minute from the 25th of September, and you're probably just about to have another meeting. So happy if you want to bring any highlights from the minute or anything more contemporary.
Okay, thank you. Yes, the Invisible Man again. But as you said, I'm reporting on the September meeting. So our next meeting is tomorrow. Just maybe let me highlight two things. One positive, we looked at our annual performance report in some depth, and it was a really good, review of it. It reminds us of just the range of services that are delivered and how much work just goes into keeping these going. And the format this year of the report seemed particularly helpful in allowing us to explore all the things that go on. So that was very, very well received. It won't surprise you to note that the challenging one is the finance side and the staffing side, and the challenges in covering a lot of the services that we do, keeping the services going, and at what cost. So it's that's obviously something that we're going to address, particularly tomorrow. We're going to be really trying to look in a bit more depth about how we're responding to the financial and service pressures that there are just now. But as we all know, no easy answers, and we're probably we're just trying to get a real idea of what particular areas are being most squeezed and why. So I'll report on tomorrow's meeting and our January meeting. A man out of time. Thank you.
Thanks, Graham. Okay, any questions or comments for Graham? suppose we recognise those challenging conversations you've described that will be coming up in your meeting tomorrow, Graham. Okay, not seeing any hands up, although I've just realised I've closed that screen, so let me open it up again just to be sure. Oh, lovely. Okay, that's great. Thank you, everybody, for those updates. So just to remind everybody, we were being asked to confirm that adequate assurance has been provided from our board governance committees and note the minute and agreed actions from the ACF and the IJB. Is everybody happy with that? Thumbs up. Lovely. Thank you, everybody. Okay, we're a little bit ahead of schedule. That takes us on to item number 4. This is our integrated performance and quality report. And excuse me, I am going to invite David to speak to this item, please.
Thanks so much, Sarah. Good morning, everyone. You should have a copy of the integrated performance and quality report for our November board meeting in your papers, and the combined papers between pages 57 and 96. I think it's been demonstrated in the conversation that we've had already this morning that this report has gone through in its various guises through clinical governance, staff governance, as well as finance, resources and performance committees. And if I could be so bold, the action that we referred to in our action plan for our board at the beginning referenced around frugal governance, around IPQR, and the fact that some of the things I'm about to highlight have already been discussed and very well connected with those reports. I think it makes a huge improvement in terms of the sequence of the meeting, actually having this straight after the board committee reports. So I've mentioned just a few things just in terms of introduction before I open it up for more general questions. The executive summary is available, and it continues in the format that shares both our performance this year in relation to last year, as well as where we are against national targets and ADB targets where we have them. For CAMS, as we go into some of the detail, it still remains an area of focus for us as a board, as well as with Scottish Government. You'll be pleased to see that there is some marked improvement in this past month, and it's good to see that report. Also, if I can point to the page where that is presented, you'll see where that is impacting our overall waiting times around CAMS, and again, there has been reduction there. So that's good news, and we'll hope that that is sustained over the coming months. You'll see that there is a report around 2 areas of screening and vaccinations from a public health point of view. Uptake still remains our challenge, and in particular in screening, there's some analysis around inequalities, and again, that's another lens that we're going to try to expand a little as we look at our performance reports to make sure that we are mindful of any impact in that regard. We've talked about vaccination specifically in terms of uptake. We suspect that delivery model has some impact on that, but that's not necessarily the case across the board where there is very good access or easy access in some areas. But in general, our uptake across Highland is slightly less than what it is nationally. So I think the messaging around that is the public messaging around that and encouragement through our staff groups as well is going to be very important in terms of taking forward. Delayed discharges still remains one of our most significant challenges across the board. It's a large area of focus. We have stepped up considerably our attention and the number of meetings that we have in regard that, how that we're using our capacity to the maximum. We've talked about protecting our capacity in the earlier part of the discussion around care homes, and care home capacity remains the most significant challenge within that. It is a high area of focus from a government point of view, with many very structured meetings going to the highest levels in government, as well as individual political ministers that would meet with us on a regular basis. So it remains an area of focus for us, and there's a lot of work going into that Unfortunately, we're not quite seeing the improvement that we had hoped for, but that just perhaps demonstrates the level of challenge that remains in that space. As far as scheduled care is concerned, Alex mentioned our outpatients and TTG performance is pretty much on our ADP targets. A personal note, I was able to join a meeting with Scottish Government in support of Catherine, who heads that up in her executive lead position. And the feedback from Government was very positive, not only in our being able to protect our ADP targets and performance, but also in relation to the additional bids that we had put in to be able to make further reductions in our waiting times. They were very satisfied with how we had used that money and had delivered, and in some cases over-delivered against our original commitments. Cancer performance, again, is another area that the board and exec team are very focused on. It still remains an area that we will be reviewing. We had a little bit of a review even yesterday and again later this week. I think maybe one update from the report that you're currently seeing, that in the most recent numbers that were shared yesterday, there's been some improvement within our cancer performance, but recognising that there are a number of small specialty areas that have an impact on our overall metrics. Psychological therapies is still one of our higher performing areas, and the sustained improvement that we've had through psychological therapies, you'll see in relation to our national performance, places us in a much better place than we had been. So very much credit to the team that are working on those areas. Later on in the report, you'll see some information in regard to patient feedback, which is always important to us, and patient experience. And in particular, our listening and responding section this month is reporting around maternity, midwifery and neonatal. And then finally, as mentioned in our people section, the marked improvements we've seen around vacancy time to fill, which has already been mentioned, is also good to note. So with that, I will open it up for questions and look to my executive colleagues to support in those questions, but happy to take those and coordinate that in the next section. Muriel, good morning, if I come to you first.
Good morning, and thank you for the report. Just one of my colleagues mentioned children's vaccinations this morning, and I notice on the executive summary, not applicable is across the line, and there's no ADP target. However, it says it's below target. So sorry if I'm missing something here. Just like a bit of clarity on that. Thank you.
Yeah, I would suggest, thanks, Muriel. I think there isn't actually national targets, but I suppose it's below the national average. I suppose is what is really being trying to convey there. We're using a standard template, and although that's not necessarily available to us. But Tim, I don't know if you want to add any more colour to that in that respect.
Yeah, I mean, I think there isn't the target for vaccination, generally speaking, for these vaccinations is 95%, and that's what the World Health Organization are looking for. So that's why we would say that it's below target, because we want to get higher than 95%. But there aren't any other local targets that are fixed. So what it's one of those things where, like with many things, we want to maximise what the target is. If we're looking for a target, there is an international target of 95%. So that's where the slight confusion comes in. And with some areas we're pushing around 95, but generally speaking we're lower. For Scotland as a whole, as you can see on here, we've got most of the areas below 95 for Scotland, certainly when it comes to MMR. But it's quite difficult, because if we set a target locally or nationally, really we ought to set that one at the same as the World Health Organization target of 95. But with some vaccinations, that's actually quite difficult to achieve. With the 6-in-1 vaccination, as you can see on the IPQR report, it is in some cases, certainly within Argyll and Bute, possible to exceed the 95% target. But that's so hopefully that explains the slight inconsistency.
Thank you, Tim. Thanks, Fiona. If I come to Emily, please.
Thanks, David. I've just got a couple of bits of feedback which don't necessarily need a response, and then one more substantive question, if that's okay. I think, so I just wanted to ask about the certain slides where it's really obvious whether Argyll and Bute is included, and others where it's less obvious, and some of them are just Highland. I wondered if that could potentially be made clearer in future versions of the report, just to allow those of us that sit on the IJB to have a chance to extrapolate and maybe fill in some of the gaps where we're not seeing that data at board level for Argyll. Then just around the inpatient falls slide, there's two charts and they're both showing slightly different numbers, but they're not labelled. So I just wondered what they're at. Is it different hospitals that are being shown? Presumably one of them is Regmore, but just if they could be labelled in future, it would be easier to interpret. And then the more substantive question I have is just around appraisal completion rates. I don't want to duplicate anything that's been discussed at staff governance, but the number just seems kind of concerningly low. And I know Gareth mentioned at one point that they were looking into whether the figure is actually accurate, but it just seems, given that retention and recruitment is such an area of focus, this is something that ought to be within our gift to improve. And I just wondered if I could get an update as to work that's being done towards that. Thank you.
Yeah, thanks, Emily. Just on the first two items, and I'll pass over to Gareth for the next part. Yes, we have committed that we will identify on the charts where it's explicitly included or whether it's identified separately. So that's a work in progress, and so my apologies. Just as the people have transitioned in that space over the last little while, we'll make every effort to try and do that for the next time around. The inpatient falls seems to be a formatting issue where the labels have fallen off the charts as they've converted, so apologies for that. The first is inpatient falls totally as a total number, and the second chart is inpatient falls with harm, just so that helps inform you directly with that. But Gareth, can I come to you in terms of appraisal rates, please?
Yeah, it was discussed at staff governance. With the highlight to the board, we have got an improvement plan in place with the directors and their direct reports to complete before the end of December, the appraisals, and then we'll look towards rolling it out across the organisation. That shouldn't mean that people shouldn't be looking at in the interim and completing appraisals where they can. This definitely needs a focus, and I will be discussing again with executive colleagues how we provide a bit more focus on this next year, probably through our performance review and other mechanisms to ensure we're actually really focusing on this. One aspect we're looking at the moment, which doesn't account for accounts for a certain percentage could be improved, is errors in how CHURAS has been completed. So we've reviewed a handful, audited a number of appraisal records to see that people have completed the conversation, but they haven't signed off properly the CHURAS record, so it's not coming through. And it's to some extent due to the way that the guidance is written, but also the layout in terms of how CHURAS is ordered. So without getting into the details, it's not necessarily intuitive. So we just need to recommunicate that back out to staff. Potentially around 2,500 records that are showing as some activity within the last 12 months, but not signed off, which may indicate that that's around 2,500 appraisals that have been done but haven't been recorded. So given our staffing is around 11,000 staff, that's quite a significant chunk. However, we've got to progress that through and make sure that is actually the case. And it also won't take us to the levels we need to be at as an organisation. So yeah, definitely a bit of focus required on that as a board.
Thanks, guys. Elspeth, I see you've put your hand up. Did you want to come in on this topic? No, you didn't. All right. So, all right. Sorry, I'll come back to you later then. That's fine. Thanks, Gareth. Thanks for your question, Emily. Anne, can I come to you now, please?
Thanks, David. So I've got a couple of questions. You mentioned, David, that we're trying to have an increasing focus on inequalities in this report. So I wanted to ask whether we would be able to, whether we have the ability to look at our areas with long waiting times to identify whether there might be any inequalities issues in terms of those of our patients who have the longest waits. I read something recently that suggested that that might be an issue in terms of long waiting times for cancer, and that's just what I was reading about at the time. So I just wondered if that might be something that we should be looking at more generally in terms of those areas where unfortunately we have a long waiting list and we have people waiting quite a long time. The other area we've also mentioned in a couple of places today, yourself, you've drew our attention to the improvements that some of the improvements that have been achieved, including CAMS and psychological therapies. And Fiona mentioned earlier the great news about the JAG accreditation. So diagnostics and psychological therapies seem to be areas where we're managing to sustain improved performance. So I wondered, are we looking at whether there's anything we can learn from those areas and how they've gone about improving their performance that we could take into other areas of our work? Thanks.
Thanks, Anne. Two very good questions and not necessarily easy to answer in that respect. In terms of inequalities, it's something that has been more topical in conversation of late in terms of how exactly we might go about being able to extrapolate the data with regard to inequalities, and waiting times indeed was one of the areas that we looked at. So it's a new piece of work that we're about to try and start. And between their strategy transformation team as well as public health, we'll need to correlate our brains together to come up with how we might exactly do that. So we certainly have that on our work to list, and we'll be happy to report back in progress as we try to make that and take that forward. With regard to learning, I think that's it's a really good question. I know that Louise wants to come in and maybe add some colour to that as well. Louise.
Thanks, and I think it's a good point, and just to try and make sure that we learn from anything that we're doing well. And just an example of that is that when we're looking at the CAMS improvement work, we're very much aligning some of the work that was done in PT, and the director of psychological therapy, which is Alison Turnbull-Jukes, who's done a lot of that work to get us into the position we're in, is very engaged with the CAMS work as well, so that we can have that read across of the two areas. And I think that's just one example of where we're doing that. I think we just need to work out how we replicate that a little bit more and just take a step back and say, well, what did make the difference?
Thanks, Louise. Okay, thanks, Anne, for your questions. Alex, can I come to you, please?
Yeah, thanks, David. Yeah, a couple of comments. I think it's looking good, and I like the fact that we've now got the ADP in there as well, and we're looking at the performance. In that case, a couple of questions. First one for Richard on the net carbon zero approach. I was surprised to see that Rigmore wasn't number one. Isla Hospital and Dunbar Hospital were. I know it's normalised, but is there anything that we're doing in those two particular facilities to try to reduce it in terms of the resources available to us? And the second one, I'm completely in agreement with Emily. I think the appraisal completion rate number is not good and hasn't been good actually when you look at the chart for the whole year. So, Gareth, can I push you on a kind of date or time that you think we're going to start to see some improvement? Are we talking about the next month? Are we talking about the next 6 months? When do you expect to see an upturn? Thanks.
Okay, thanks, Alex. Richard, can I come to you then in the first instance?
Yeah, thanks. Yeah, Alex. The two hospitals are on heavy oil just now, so we're working to remove them. So obviously they're smaller hospitals, but per square meter they produce more carbon emissions. So the project's ongoing this year. We're pretty confident we'll get one of them moved over to a renewable solution to support the reduction of the use of oil. And we've applied for funding to look at the other one to see if we can do the same with that one. So within the envelope we have, we're working to reduce those two down and also continue work at Rigmore.
Thanks, Richard. Before I hand back to Gareth, just maybe it's worth recognising that when it comes to appraisals, then all of our executive colleagues at the table have a responsibility in being able to push that whole agenda forward. And please, Gareth, as you come back in, you become the SRO in that sense of it, but we recognise we've got a shared responsibility around this. But Gareth, I don't know if you want to add anything further.
No, I think, thank you, David. That's a useful introduction. I think what I would like to do is to take this away and have some conversation with executive colleagues in terms of what trajectories we want to set over the next year. What we have certainly introduced is an approach that we hope will push it in the right direction in terms of a cascade out. But I think this probably needs more of a focused performance management approach potentially. So I think that's something we need to pick up collectively, as David says, in terms of how we approach that, what we agree is going to be realistic in terms of trajectories to pick up. So I think it's a valid challenge, and it's something we should take away and come back and agree through both staff governance, but also to board what we think a reasonable trajectory is to work towards over the next year.
Thanks, Gareth. Thanks, Alex. Steve, could I come to you, please?
Hi, David, and thanks for the report. I think it can sometimes be quite a challenge, this report reading. But what I really liked was in Boyd's section on complaints, where we included some compliments on midwifery. And I think that just added just a welcome little bit of balance in the report itself. And also I think for staff themselves, just to see that, I think will be quite helpful in terms of morale. My question is on the people side, and I noticed we've got a target of 10% for staff turnover. So I guess I'm just looking for some reassurance. I know that's a bit of a standard metric for an organisation that's operating without any overheating in recruitment and retention. So just looking for reassurance that's not something that we're chasing, given the prevailing circumstances that we face from a staffing perspective. Thanks.
Thanks, Steve. And before I come back to Gareth, just on the patient feedback, I think it's we're a classic management by exception organisation in so many ways, and we tend to look at the negatives or look at things through negative lenses. So we sometimes feel a bit embarrassed about putting positive stories out there at times, but actually the feedback from patients is predominantly positive, which is very encouraging. Not necessarily always on a formal basis in the way that that's submitted, but we do get many positive areas of feedback, and the teams can take great encouragement around that. And I'll maybe come to Boyd if there's anything else you want to add to that, Boyd, before we come to Gareth around staff turnover.
Yeah, grateful for the mention, Steve. And I think it is important to look at complaints where things have gone wrong and to understand that's a necessary part of the NHS. But it tends to look at the small percentage where that happens and misses the measurement and understanding of where it went okay or it went well. And so I think we're in the foothills of capturing more of that and understanding it, because how we run normally when things are working is actually of great importance. And I'm hopeful, as is the nurse director, that our quality framework document that's recently been completed and is now being it's been to area clinical forum and is spreading through the organisation, that we can gradually develop a greater understanding right across services of activities that are going well and that are working for people, and understand how we improve in that context and what that means for us, as well as the smaller number of instances where it doesn't go so well and could be obviously improved. So thanks for that.
Thanks, Boyd. Gareth, staff turnover?
Yeah, I suppose the just to clarify, the report shows we've got 8.66% turnover currently in this month. So we're well below I suppose our own target that we've set to be below that. So I suppose it's interesting to say what is actually what target should we be aiming for? Does it need to be lower? Does it need to be higher? So that's something we talked about in staff governance as part of the development session. So I think I think that's a question for us to ask ourselves is, where are we at within the overall benchmarking across Scotland? And I was just having a quick look at the data that's available on the national benchmarking, which is annual data. So we are maybe slightly higher than that average overall, but that does take into account the range of different boards. So I think it's probably a conversation we need to ask ourselves: are we in the right ballpark for us as an organisation in relation to others? The other aspect of it is then understanding what we can do about it if we think it's higher than it should be. So I think that's something for us to have further conversation about. We were talking about this yesterday briefly around potentially doing some audit activity around this next year, about understanding our turnover rates in a bit more detail and perhaps going into a bit more depth and using internal audit to help us with that process. We know that exit interviews are notoriously hard to get people to complete. We do tend to get destinations where people go. But again, that has to be limited. Some people don't supply that information. So it's maybe an area that requires a little bit more deep dive to understand, is there anything in there that we need to look at and address? So I'm not sure I've quite answered the question, but I think the 10% is looking a little bit out of kilter with where we're currently at when we need to look at that when we're setting our targets for next year.
Thanks, Gareth, and thanks for the question, Steve. It certainly will make our heads put together to look at that. I suppose my own reflection is also in conjunction with the age profile of our workforce, recognising that there will be a number of retirements within that. But again, it's not that we want to be complacent, so actually digging below it to get to the reasons behind it will be a real positive opportunity for us. Elspeth, thanks for being patient. I almost gave you your chance earlier on, but I'll come to you now.
Thanks, David. It's probably a question for Louise and Boyd, and it's really around the slide around listening and responding to our patients. And it just seemed to me quite negative with the four items, the picture format, and also just a little bit more explanation around the pie chart, because obviously it's stating that the stage 2 complaints are 59% and that. So is that in relation to the 282 incidents raised in maternity? So I suppose for me, it was just really what insights to current performance do we actually have, and if there's any plans and mitigations in and around some of the information that's been identified. I just felt it kind of lacks some narrative in and around it.
Okay, thanks, Elspeth. I don't know, Louise, if I can come to you in the first instance around that.
Yeah, absolutely. And I think Boyd will want to come in. And I think you're right, Elspeth. But it is very much about how we get that balance and how we get the detail that we're not quite there yet with. But I think this is something that we just need to develop over time and get to a better place with. Because clearly we want we've said earlier, we want to be a learning and understanding organisation. So I think it's how we do that. I think we are doing it better in some places. It's maybe just how we articulate that we're not quite getting so that people are feeling what work's going on. But I think there equally is more that we need to be doing in terms of that listening and responding aspect.
Thanks, Elspeth. But we'll certainly take that away and reflect in terms of how it's being reported to see if we can try and improve on that so that it's more explicit in terms of this chart, and as we apply it into different areas. If you recall, this is a relatively new section that we've introduced into the IPQR, and we rotate, if I can describe it that way, around a number of different areas of focus. So, but we'll definitely take that away from your question. Okay, thank you all for your questions this morning. I'm going to unusually hand back to the chair in plenty of time. Thank you, Sarah.
Thank you, David, and thank you, colleagues. I think it's worth complementing this kind of iterative process that we go through with the IPQR, similar to what Katrina was saying earlier about ACF. There's a lot of data that we have access to, and we could kind of drown ourselves in it, but I think that's been a really helpful conversation. I like the way that worked today, and I think we had this conversation last time about assurance. We're trying to kind of bring a hugely complicated and complex organisation and sets of data into one report, which I think has been done beautifully well. So thank you to the teams that do all of that, to give us a kind of an overview of the whole organisation, which is really, really difficult. And I just want to pick up, there's some areas of really, really good performance and improvement. It's great to see that. Areas of ongoing challenge, which we know about, but it's good to get that overview, so thank you for that. And really pleased to see as well more around that patient feedback. So something that we talked about at the annual review was that in particular about how we use patient feedback and experience and quality, those kind of outcomes, to feed into both how we look back at how we've done, but also how we take forward our quality improvement work. So it's great to see that coming through in the IPQR. And thank you, David, for colleagues for all of your really thought-provoking questions. So we are being asked to take limited assurance. Again, picking up the conversation we had last time around this, there are some areas where we could say, we've got substantial assurance, some areas which would be moderate if we took them individually, but clearly we do have some areas of significant challenge and pressure. So take from that what you will, but that's what we're proposing for the sake of the paper today. Is everybody content that we take that approach at the moment? Okay, super. Thank you very much, and thank you, David, for your choreography of that, as always. Okay, we are moving on now to item number 5. This is our finance assurance report from Heleth, giving our month 6 position. So I'll hand over to you, Heleth.
Thank you, Sarah. So I'll just go through the highlights of the paper. At month 6, hopefully you remember we did commit to undertake a detailed review of the forecast position by assessing the delivery potential of the value and efficiency schemes and reviewing projected spend against specific allocations and any potential slippage and balance sheet benefit that could be realised. So although the overall forecast has deteriorated in month 6, as mentioned by Alec, that was discussed in the FRP update, and that's above our planned deficit of 50.6 million and increased into 51.98 million. This is due to a communication that we received regarding an MDT allocation. And although the National Fund has reduced from 47 million down to 40 million, the Highland Health and Social Care Partnership share of that, which was 1.785 million, wasn't confirmed to the full amount. There was only just over 100,000 of that being provided, which then impacted that forecast. Just to confirm, at month 7, we have received confirmation that that will be fully reinstated, and therefore the forecast is now reduced back to 49.7 million, which is just under £1 million improvement from our original opening plan. The operational spend is continuing at the anticipated rate, and the year-to-date position is 42.4 million, which I'm sure you'll note is not too far off the forecast year-end position. That's due to three main factors. So the first is the reduction in forecast against our value and efficiency work streams and some of the schemes that will deliver towards the end of the financial year rather than at the start of the year. We have our recovery plan in place, which includes balance sheet benefits, and they will be realised at the end of the year, and we'll go through that a little bit more in detail. And then the third impact is the adult social care and Argyll and Bute positions, which have a combined forecast of 16.1 million, and we are assuming will balance at the end of the year. Argyll and Bute are committed to this action, and for adult social care, the NHS is still committed to reducing spend through our efficiencies within adult social care, where appropriate to do so. And we're focusing with the council on the long-term sustainable plan and working with them on how we best access and utilise the 20 million transformation fund that they've made available to us while we work through that transition. So the key risks to the financial position are similar to previous, but some of these have been seen of note. So there is the risk that we have an increase in our supplementary staffing over the winter periods in particular, that the increase in costs within prescribing continue above our current planned rate. The adult social care independent sector fragility, as mentioned by Fiona with Moss Park, we are seeing concerns of other care homes with requirements for some sustainability and also reductions in care at home independent packages. And we've also got the allocation reduction risk, where we have seen a couple of examples this year which have impacted our planning assumptions and our service delivery. So we've provided reconciliation of the adult social care position for reference on page 105 within the combined packs, and within pages 113 and 114 we've provided a bit more detail on that value and efficiency slippage and the actions that we've identified to offset that slippage to maintain our in-year forecast. So you can see that they are predominantly balance sheet impacts of where we know we've got reduced accruals due to areas that have now been finalised within our position. And I do want to just highlight as well that we have made reductions in supplementary staffing expenditure, which is quite an achievement, and that should be recognised. For capital, our spend is being committed and we are confident that all of that funding will be spent by the end of the year. And I just wanted to highlight as well the additional specific allocations that we've received. One to replace the Belford Distribution Board, and also we've received funding for 1 out of 2 SSD steriliser replacements, the second of which will fund through the contingency. So finally, we've just included the financial planning timetable for information, and we're expecting more information on the financial settlement for next year following the Scottish budget announcement, which will take place on the 4th of December. And then just finally to highlight that as part of our escalation at level 3 of the financial framework, we do have monthly catch-ups with Scottish Government finance team and a formal quarterly review. We've just had our Q2 review where the focus was predominantly around our forecast position, any opportunities to improve that forecast, adult social care and delayed discharge risks and pressures, the allocations conversation. We did touch on Meridian work, and we just highlighted all the other risks to our position, and we touched on the financial planning for next year. And I'm happy to take any other questions at this point. Thank you.
Thank you, Heleth. And sorry, colleagues, I'm shielding myself. I'm sitting with the sun right in my face. I shouldn't complain. But if I turn any other way, I'll have a halo behind me. So I'm going to sit like this for a second until the sun moves. Thank you, Heleth, for taking us through that. And obviously, Alec gave a kind of a feeling of what was discussed at the recent FRP meetings. But happy to take questions, comments. Obviously, our financial position remains significantly challenging, but it's good to see the huge amount of work that's going on around that. I'll pause now and bring others in if they have questions or comments for Heleth or others. No, okay. I'm not seeing any other questions. I wonder, oh, sorry, Anne, on you go.
So, Heleth, I wondered if I could just explore a little bit further the position on the adult social care situation. I suppose I'm thinking, it's month 6, as you said, the key risks highlight that we don't have a plan in place to deliver break even for adult social care, yet we're still assuming that it will break even. So I wondered, do we have further potential mitigations to cover this assumption if we aren't able to deliver a plan? We're obviously, moving towards the end of the year now, so any improvements will be part year as well. So I just wondered, and at the very least, if there are no other mitigations available that we're aware of, should the risk that's on the strategic risk register around this situation actually be very high rather than just high. So I guess I'm issuing a bit of a challenge on the continued assumption that we're going to break even in that respect. Thank you.
Thank you, Anne. And yes, it's a fair challenge. There's been ongoing dialogue with the council, and I met with my equivalent from the council a couple of weeks ago, where we've started to have the conversation around how do we balance the position for the year end and what opportunities we may have in that space. We don't have anything formal in writing at the moment or how we work through that, but the conversation was far more positive than we've had in previous times, with the commitment to work together. And we've been very clear with the council that there is an expectation that the adult social care budget does break even within the health position, and they're happy to support that work. But I think there will probably be some work needed around the trajectories and what we expect around our future plans to enable releasing some potential support in that space. So we're working through it. I'm more positive than I probably have in previous months around that forecast position. The conversation said we're really positive, and I'm assured that we will be able to work through that together. And Brian and I now have formal monthly meetings in place as well, so that we can work through that as you say, the year goes ahead. So there are no specific plans in place at the moment on reductions other than the value and efficiencies, and some of those we need to drive a little bit harder on, but it's more focusing around the longer term sustainable plans and how do we get that transitional arrangement using some of that transformation fund, as I said, to help support us while we work through that, recognising that change won't happen this financial year, but also the health position can't be at detriment. So the conversation is definitely progressing, which does give a lot more confidence.
Thank you, Heleth. And I'll bring Steve in next, please.
Thanks, Chair. Thanks, Heleth. I was actually going to bring this up at the risk register item, and I sort of just wanted to just endorse what Anne had said. When I look at the risk, there's a very sort of, just an observation, very thin, what appears to be a very thin risk management plan sitting under that. Doesn't talk about transformation. So I think maybe just I would welcome another look at that risk if we could, just to reconsider it, if that was okay. Thank you.
Thanks, Steve. That's helpful. And actually, we have got the risk, as you said, we've got the risk item, but we can capture that now. I think that's a really helpful suggestion, and we can pick that up in the other discussion as well. Just in terms of not necessarily something for us to pick up now, but I suppose just to pick up on a few points as we come closer to the year end, and I think, picking up on the points that you made, Heleth, when you were responding to Anne about that kind of that longer term piece and that transition, it would be great to think about how we take that longer term piece potentially through FRP and our other committee structures as we get closer to the end of this year, sort of looking into the horizon. I know you've got that timeline at the bottom of the paper, which is really helpful. And I'm just thinking about how we kind of do that within our committee structures so that we start looking beyond the horizon point of this year end and into the next one as that comes a little bit closer. Alex, I don't know if you want to come in before I bring Heleth in.
Yeah, thanks for that. Yeah, it was something that we discussed before at the FRP as much as anything else. I think it's time that we start to look at what the transformation work, I know it's medium term rather than short term, but what the transformation work is doing and how we're progressing with it. Because at the moment, we don't see that, or at least we don't discuss it in any great detail. So I think at FRP level, I think that's something that maybe we start with there and then move it forward to come into board. I think it's something that we might benefit from, because what we can see at the moment, and I think Heleth would probably support this, is I don't think that number, that 49, 48, whatever it is going to change very much between now and the end of the year. So we're kind of, not stuck, but it's a number that we're working with and projecting for quite some considerable time. Where we're looking to see the benefit from is the transformation, the medium to long-term work that's going on. Thanks.
Yeah, absolutely. Thanks, Alex. Heleth, I'll bring you in.
Thank you. Yeah, just to confirm, as part of the financial planning for next year, Scottish Government are really keen to work on more detailed 3-year plans. We've always had to submit 3-year plans, but year 2 and 3 have been very high level with just assumptions around inflation, and they want those years 2 and 3 plans to be far more detailed than we've had previously. I agree with Alec around some of those projections of our transformation and change. At the moment, I'd say we've got areas for opportunity and strategic directions, but not necessarily the detail that we need to be able to translate that into financial impact. So that's the bit that we really need to get to.
Okay, that's helpful. Thank you. Anne, I'll bring you in, please.
Well, it was just to really endorse that last point, and in terms also maybe to have a think of how we discuss that not just at FRP but in at a board level, and indeed possibly even whether the finance report in future needs to take account of that need to focus more on the transformation element. And I think that's particularly important given when we look at the information about the value and efficiency programme. For example, in the North Highland element of that, it looks like we're delivering just over 6 million out of a 21 million target. And I absolutely understand all the reasons why it's been very challenging to deliver on our savings target. And it's great that overall the picture is still that we are going to do what we said we would do in our financial plan. But it seems clear to me that for very understandable structural reasons, we are really struggling as an organisation to be able to achieve recurrent efficiency savings, which to me really emphasises the need to refocus our scrutiny on the transformation side of the agenda. So from that point of view, I think it's a really important point that we've been discussing, and we need to think through how we refocus our consideration at board level as well as FRP, I think. Thank you.
Absolutely. Thank you, Anne. And Karen, please.
Thanks, Sarah, and building on comments of others. I guess it's a question for our executive colleagues around perhaps an honest reflection of the resources that they have available to them for this type of work. And it may be helpful to bring something back to the board that outlines where there are gaps or where they're going to have challenges in building and taking forward some of this work. Because I think that we can see that the ideas are there, and it's great to see that the ideas are there, but there's also a lot of challenges in the BAU work, and we know that BAU trumps transformation at every opportunity. So it may be just a reflection for executives around where they have perhaps a desire to make changes, but they know that they just don't have the resources to do it within their existing teams. And that might be something that could be that the board can help support. Thanks.
Yep, no, that's really helpful. Thank you, Karen. And Fiona, I'll bring you in.
Thanks, Chair, and thanks, Karen. I think that's a really helpful point. I think the way that we've been trying to look at this just in recent weeks and months is to say, with the resource we've got, how can we target some of the areas that we know are the most complex but the most in need of transformation, recognising that we probably can't cover all of the bases in regard of having additional project management support or other skills that we know are really necessary and required to make that redesign, that transformation change, rather than, as you say, the business as usual approach. I think it would be useful for us to bring further updates on that to the board. I think it would be useful for the board to be kept up to date, and recognising Anne's point that connecting that to the question you asked earlier about inequalities is essential, that we don't worsen existing inequalities in our society, that we strengthen and target our approach to inequalities. So I'll take that away and work with the team, Karen, and come back to you and try and offer some greater clarity and assurance and transparency to how we're thinking about the resource we've got, targeting that to where we feel it has the greatest impact, but where we know we have the greatest challenges in terms of complexity, but also trying to evaluate whether that's sufficient to meet the breadth of the challenges that we have in the organisation.
Thank you, Fiona. Okay, so we've given ourselves a clear task to take away and think about how we bring that back in the future, which I think is very positive. I'm not seeing any other hands up, comments or questions around the month 6 position. So just to bring us back to the item as it is on the agenda, we were being asked to examine and consider the implications of the report and take limited assurance at this time. Are members content with that? Yep, thumbs up. Lovely. We're a little bit ahead of schedule, but I'm going to stick to the order of things. I'm going to suggest that we take a 15-minute break now. We can stretch our legs and get some refreshments, and I'll see you back here at 17 minutes past. Thank you.